All right, so thanks for stopping by again, SDG Live here at the studio, as well as the hashtag. Thanks to the UN Foundation, as well as GSMA. We get to hit all these really interesting topics relevant to the SDGs, coming out of the United Nations, and the Economic Forum. Here we are in Davos, as many of you know, and sort of, not really sort of, but really, the overlaps that are being discussed from the conferees. We have two very esteemed conferees here with us, as well as the topics that resonate together. We're going to hit financing in the new development era for the next 10 or 15 minutes. That's our topic, financing in the new development era. And with me, very next to my right, is Dr. Mariam Etiebet, Executive Director of MSD for Mothers. And next to Mariam, we have Mariam. It's a M&M sort of combination here.
It is.
Mariam Claeson, Director of the Global Financing Facility. So we could spend an hour on both of what you two do, but do that for me in one sentence. What do you do?
So MSD for Mothers is MSD's $500 million 10-year initiative to make sure that no woman has to die giving life. And we do that by working with partners like the GFF all around the world to support innovative care delivery models to save lives.
Catalytic financing for the agenda that Mariam has just talked about, women, children, and adolescents, their survival, but also their ability to thrive, getting a new way of doing financing for these very important, tough development challenges.
Ooh, I love this stuff. I know a lot of people think financing, but this is really interesting. And then we're going to get to some of those very specifics that you're intimating at the moment. But tell me about the Economic Forum. Both of you spent more or less 2 days listening and talking. And what has resonated based on what you do?
So I think for us at MSD for Mothers, what is encouraging to see and to hear is that there's more private sector interest and engagement in the SDGs.
Interesting.
Yes.
And what have you heard that you go, wow, that's kind of cool? What have you heard? What was the sentence that you?
So the sentence is around, well, how is it that we can make sure that we can actually support this? What are the mechanisms that we can engage in this important work? And I think part of why we're here and part of our partnership with GFF is figuring out what those innovative financing mechanisms are that can crowd in private sector investment.
Okay, so what's your 15-second elevator pitch when you get asked that question in the last 2 days? What was your like quick 2-sentence answer?
You're investing in lives, you're investing in the future. When we have women and children surviving, when they thrive, we're transforming not just themselves, but we're transforming communities, nations, and the world.
You didn't say, give me your checkbook, I can tell.
Yeah.
She hands that to me, right?
That's what she says to you. Okay, this is a great pass-off then to you, Mariam. What have you heard that is relevant to the discussion of SDGs and what you do?
I think what really resonates is this focus on human capital, that we have to invest in people, also to help countries, not just for survival and thriving, but also that's the best investment in the future. So for us, it comes together very nicely, reaching the SDGs, focusing on human capital, and for us, really critical periods in life, around birth, early years, adolescence, and then making sure we have the financing to deliver.
What's that question or statement that tells you this? Try to think back. Like you gave me some of the words, sort of paraphrase in a sentence, what that sentence that you heard that goes, ooh.
Well, it's a lot about bridging divides. It's a lot of coming together in a fractured world. That's sort of the theme here. And for us, we know we can't achieve these goals without coming together. It's collective impact, private sector partners, governments, NGOs, the UN, all of us actually coming together, and for us, coming together at the country level.
Okay, the two of you, and by the way, no need to, this is very informal. What is the new development era in a sentence?
The new development era is, as Mariam said, coming together, private and public sector, to work together around these sustainable development goals. And there's one thing actually that I wanted to follow up on what you said.
Sure.
Private sector and the checkbook. We're not just about the checkbook. It's about when private sector actually engages in this work, we not only change what we're financing and how much is being financed, but we also change how the work is being done. And let me give you one example of that.
Quickly.
So MSD for Mothers just launched a development impact bond in Rajasthan, India. And because we are focused on results, the service deliverers have an ability to innovate in real time to focus on results. And we think through that way, we're going to increase efficiencies, we're going to increase effectiveness, and we're going to make our dollar go further.
So to build on that, for us, the centrality is you bring together programs and the financings. These are not parallel conversations. So for us in the GFF, in the Global Financing Facility, the first thing we do, first of all, is making sure countries are in the lead. These are not global conversations. They have to translate at the country level. So if we get governments in the lead, they bring partners around the table, and the partners are the UN, the private sector, financing facilities, Gavi, Global Fund, GFF, and also CSOs, the civil society. If we get them around the table and they manage to do a very critical thing, which is identify the most important priorities. What are the most critical bottlenecks for rapidly scaling up to achieve the SDGs? And by looking across the continuum, not intervention by intervention or condition by condition, but really looking across, critical moments in the life cycle, we get people aligned around one investment case. And if you have one investment case, you get the ministries of finance interested. And once you get the ministers of finance interested, we can discuss domestic resource allocation. We can talk about aligning bilateral donors around one investment case. We can get our concessional financing, the World Bank, and both IDA and IBRD, both low-income and mid-income countries, together around the table.
That doesn't sound very innovative, though, Mariam. It seems like just get folks together and localize.
Yeah, well, the innovative element here, and we both work on that, is the financing piece. So, for example, what do we do?
Of course, I joke, by the way. I'm not, but it's like get the basics
the devil's
done.
advocate here. We know that.
Yeah, get the basics done.
So, for example, take countries in transition. Many countries who transition economically, the social sector is not where they put their major investments. So what we do in the GFF is we say, okay, Guatemala, if you want to invest in stunting, a huge problem and a problem in inequity, we can buy down the interest on your loan. And we do that. So we come in and say, we'll buy down the interest, the private sector can come in, but also you match it with domestic resources, and then we use that, if countries achieve their goals, we use that to then reinvest in, reproductive, maternal, newborn child, and adolescent health. So we do buy-downs, and with the private sector partners, we also purchase not just for inputs, right? We don't count how many drugs you have in a clinic. What we are interested in is outcomes, results. Are more women and children in, the Boko Haram area of northeast Nigeria getting services?
How has financing helped you in an innovative way? And I like the way you gave me a very specific example, buying down the interest. What has worked for you in the financing space that has, again, when you talk about maternal mortality, what's worked?
So the fact that we can actually pay for results. So we know, as I said, that our dollar is being used and it has impact, it's saving lives. The other thing I think in terms of MSD for mothers is the fact that we can catalyze the local private sector, whether they be local private distributors, integrate them into the healthcare service delivery chain. I'll give you one example around that. The work that we have done in Senegal with the Bill and Melinda Gates Foundation, by integrating third-party distributors into the public supply chain, we've been able to reduce stockouts to less than 2%. And as Mariam mentioned, that is an example of actually paying for results and incentivizing for results.
I saw one of those programs on the ground in Nepal, and where you had these local village leaders, in this case it was a woman, and she was, for all the new mothers, sitting down with a map. She laid out the map, and they would get their little dots. They had 6 dots if you were a new mother. Let's say I was a new mother. And I would go through the program, and I'd get a dot on that plan. And they have reduced mortality by 50%. Just based on education, as well as what you're talking about, which are pharmaceuticals or as such that will help them along the way. That's what you're talking about, giving money for results like that. Because that was, I heard 50% reduction.
And what you are talking about is really putting the front line first. So that's the other innovative element of this. We don't believe anymore in trickling down. You know, by the SDG, when the MDGs were achieved, we've done the low-hanging fruits. In the SDG area, we have to change this, and what you just described, getting local interest. You know, more preventable maternal deaths are not acceptable. Let's count them. So for us in the GFF, it's that focus on the front line first, and then we see what do they need at the front line, and can we mobilize the financing.
So that is the new development era, or an element thereof, in that the beauty of data in this era means you sitting, and you know the stereotypes, you sitting in DC at the GFF, in your seat, in your corner, the old proverbial ivory tower, right? And how would you ever know what works and what doesn't? That's the new development era. You get the data, you provide it, you get it too.
Yes,
and the other thing I want to emphasize, the new development area is also around public-private partnerships. It's what I've seen is that it's not just how we can innovate together, but through working through those new mechanisms, we've developed trust. And that has been critical. Trust not just at the global level, but at the local level. And when governments are able to understand that their local private sector can actually contribute to public goods and the SDGs, and we can figure out how it is we can better capture the value of local private providers, we change the paradigm. Another example, 40% of women actually receive critical family planning and maternal health care services in the private sector. Up until now, that's been a blind spot for development. Some of the work MSD for Mothers is doing is allowing quality of care to be increased in that sector. So again, they can also contribute to reducing maternal deaths and newborn and child deaths. So trust, I think, has been critical.
Yeah, trust, and as you point, what's new here is really also, again, back to collective impact, right? That partners really come together in a true way. We always pay lip service to countries first, right? But how do we get governments in the leadership here? And how do they become commitment? Of course, by trying to mobilize their own domestic resources. Concessional financing from the World Bank is, of course, their money. So how can we make sure that that money goes further?
Who changed, public or private? Who changed more?
I think both have to, you know, we all have to change here to meet in the middle.
Well, who changed more, though? Who changed more?
I think it's both.
I really think we've had to
it's coming together.
And isn't it more private because now they have to be more like a human being than ever? Private now, I mean, we look at the Global 1000 or the Fortune 500. They all now have the requirement, either from their vendors, their suppliers, excuse me, or from their customers, whether they be businesses or consumers. The expectation in this new era is you need as a corporation to be a person. So I challenge you only to say that I think private it's moved in a different space because consumers and businesses as buyers have changed.
Yes, but you know, at the heart of this, governments have to open the table for partners. And for me, the most exciting in the last 2 years, where we've been operational in 16 countries, is seeing governments working differently, actually develop their investment case with partners. Because if you develop a strong investment case with your partners, they also own it. So what we are seeing here is, you talked about trust. Trust is mutual. You have to have transparency on the government side, show where are your budget commitments were, and we are seeing CSO, the civil society, saying, okay, these are the results you, government, want to achieve. Here is our dashboard for keeping you accountable. So for us, that's the big change.
I give you a magic wand, both of you, or I give you one wish. And don't make it long. One sentence. I give you a wish. We're going to talk about financing in the new development era relevant to your expertises. What is it in a sentence?
Close that $33 billion financing gap by crowding in private capital to save lives of mothers and child.
That's what you would do. What's your
To
wish?
build on that, my wish is that we ensure that our financing is both going into getting more value for money. That's very important. Efficiency, high impact intervention. Secondly, we mobilize money around this one investment case that we all buy into. reduce the fragmentation, get us more harmonized, and we don't want just financing for pilots.
Yeah.
We want financing for scale and sustainability.
That's 1.5 wishes. 1.5 wishes over there. Do you have enough data, yes or no, to do what you want to do? You do have enough data?
No, we need more data. More data.
Do you need more data?
We need more data.
Yes.
That's what's going to help us scale.
Yeah.
You need 10x, 5x, 2x, what do you need?
I tell you, we need data that tells you about quality of care. We don't need to know just how many more mothers come for care. We need quality data.
So 5x?
Yeah.
10x.
10x, and you go with 5x. Tell me something we don't know about this topic, financing in the new development era. Again, in a sentence.
So I think we don't know how to do this quicker. And we need to figure out how to reduce the transaction costs in order, as I said, to crowd in that private capital.
Faster. That's something we don't know.
Faster.
We don't realize that. What don't we
And
realize?
back to data, what results are we interested in? We need, again, coming together around what is really going to drive change. So we need, so I think both data around quality, but also what are some of the social determinants that will really make a difference? Because for us, the conversation we're having now is about several sectors. It's not just about health. It is about educating girls. It's about social protection. So the data across sectors is really key.
You're saying what we don't know is what is the right data that we need that can impact this very discussion the most.
You know, economists want to know what's the allocative efficiency. So how can we really make sure that we place the money which will drive faster?
Okay, so what's the title? You can tell I like to move very quickly. Fast. What is the title of the session that is not here at the World Economic Forum? I gave you the programming book. Okay, you get to put that session in. What's the title of the session that needs to be here?
Country-driven, scaled, smart, sustainable financing. And of course that gives me the title, right? Because that's what Global Financing Facility is about. But it is really about smart, scaled, and sustainable financing.
The voice of women and empowering them to make the right choices at the right time so that they always have access to high quality care.
That's a long one. We may have to edit that one, but a good one. They were both good ones. And I thank you both, Mariam as well as Marianne.
Yes.
What a fantastic, fun conversation.
Fun.
Around, if all things, financing, just by itself. But no, this is very important. Financing the new development era here at SDG Live, here in our SDG Live studios. And of course, you can go to the hashtag to see all the other conversations that we have had so far. And of course, it's only day 2. I'm looking off camera. Day 2. Because it sort of gets that way. The street is literally 5 feet behind this wall. So you may hear part of it throughout this. Thank you, and we'll see you for the next conversation.